If you have a young one who plays competitive sports, then you're probably pretty excited about the research, the innovations when it comes to concussions. If you have questions, we have answers because we have Dr. Lisa Manderino, and Dr. Manderino is with Aptiva Health. First of all, welcome to the show. Welcome back.
Thank you. Thanks for having me back.
You are a wealth of knowledge. So I guess we should probably start out with the basics. What is a concussion?
So a concussion is a change to the way the brain cells function. It's actually not observable on any sort of brain scan, like a CT or an MRI wouldn't show a concussion because there's no bleeding, there's not necessarily swelling. It's a change to the way our brain cells are firing. So
how are they diagnosed? You say it's really hard to tell with a scan. So how do you diagnose as a doctor a concussion?
Yeah, so a concussion can occur when there's any sort of traumatic force applied to the brain. A lot of people might think that means you have to be hit in the head, but that's not necessarily the case. Any force to the body that also causes a jarring of that head can cause a concussion. So to diagnose a concussion, we start with just sitting down and having a conversation. What happened to you? Do we think those forces were enough that they could have reasonably caused a concussion? We talk about what symptoms you might be experiencing since that injury, and then we do have some tests that can help us determine if there are specific deficits or problems that have occurred because of a concussion. We do some computerized neurocognitive testing or testing of thinking skills like memory and attention to get a sense of how those things are working and if they've been negatively impacted by a concussion. And we do a physical exam of several different systems in the brain.
So, Dr. Manderino, you and I had a brief conversation during the commercial break, and we were talking about the NFL, and I think that's how most of us are familiar with concussions because, unfortunately, they're pretty likely to happen during the course of a game. With that being said, NFL has been helpful, haven't they, as far as research and innovations when it comes to concussions?
Absolutely, yeah. We were talking about how studying concussion historically has been difficult because we can't always identify when a concussion is going to happen, and by the time we know that someone's had a concussion, we've missed some of those data points in what they look like in the early injury. So professional athletes give us a really good population to be able to study concussion because we know for a fact that some concussions are going to happen on these fields, you know, on certain days, so we can be ready with different research studies, and it's really helped the field come a long way. We've developed a lot of different treatments and recommendations for concussion based on studying that population that then trickles down to the average patient.
Okay, so let's talk about that. You mentioned treatments. I know it's tough in this short period of time that we have, but maybe some basics, some treatments, maybe folks who think they may have suffered or a loved one has suffered from a concussion, what can they do?
Right. I'm glad that you're asking what can they do, because historically it's been thought that there's nothing to do for a concussion, just rest and it'll go away. But more and more we're finding that's not the case. And in fact, if we rest a patient too much, some of their problems can get worse. Imagine a vibrant person like yourself, you are told, well, just lay in bed all day and until you feel better. Well, when would you feel better laying in bed all day? That's not you.
True, that's a good point, yeah.
So keeping patients active and engaged in many of their daily activities as much as possible gets patients better faster. And we can pair those types of recommendations with active treatment strategies, sometimes physical therapy, sometimes medication is indicated, but not always. Sometimes very specialized evaluations of things like balance or vision are indicated, but there are targeted treatment strategies that we can apply based on the specific presentation that a patient has.
I think, Doctor, obviously with contact sports, you're probably going to see concussions. Football, boxing, lacrosse, any contact sport. Are there any occupations where you seem to find that there are more than a normal amount of concussions that occur?
That's an interesting question. I guess maybe more than others would be any sort of physical or manual labor type position, people who are moving and operating heavy machinery. But concussions can happen from any sort of unusual, atypical freak accident, right?
Sure.
What's to prevent you from a boom mic coming down on your head, even though you don't have a particularly high-risk occupation necessarily? So there's no one that is safe from a concussion. I don't say that to sound scary, but I do think sometimes patients can downplay, well, I'm not an athlete, I'm not someone who has a really physical job. Yeah, I got hit in the head, but it's probably nothing. But I see a lot of concussions every day from patients who had injuries that you wouldn't necessarily expect to cause a head injury.
So when folks are watching today, if a viewer's watching and they say, okay, what is the threshold? When should I know to see a professional like you, Dr. Manderino? Is there a red flag? You go, okay, if you see this, come see me.
So there are certainly red flags that mean go to the emergency department, not to me. And that would be anything like after a head injury, having repeated vomiting or a loss of consciousness. Those would be red flags to go to the emergency department. But if someone's hit in the head and they're experiencing over the course of several days symptoms like persistent headaches that are really atypical for them, or dizziness can be a big one. Mood changes is one that people might experience, feeling more irritable or anxious compared to what's normal for them. Significant disturbances to sleep, all of those would be indications that maybe a head injury has occurred, and it's worth coming in and having it checked out.
There's been a lot of attention on CTE and the seriousness. If you've had a concussion or maybe repeated concussions, should you be worried about that? And is there anything you can do to test it? Can I possibly develop CTE? Are there tests for that?
So there's a lot that we don't know yet about CTE, and there's a lot of media and a lot of attention out there that would make it seem like the jury is out on or in that the decision has been made about CTE. But in fact, there's a lot that we don't know. Even as far as its relationship to repetitive head injuries is still a little bit of a question mark in the research. You wouldn't know that from listening to some of the media that's out there. But I'm really hopeful that as we develop our treatments for concussions on the front end, and as we do a better job treating patients sooner, we won't see those long-term deficits and as many patients going on to develop these chronic issues, because we're treating the injury up front. The same way as if you have a knee injury and it's dealt with right away, you're less likely to have chronic pain or stiffness in that knee 20 years down the line than if you never have it addressed and you keep running on it for 20 more years.
With our final 30 seconds or so, Aptiva Health. You're obviously very accomplished, impressive resume, well-educated. Why Aptiva Health for you? What attracted you to that company?
Well, thank you for saying that. The reason I chose Aptiva Health is because I am so excited about what we're building here. I had the opportunity to come on board and help partner with the administrators and the rest of the team at Aptiva. We are building a multidisciplinary concussion specialty clinic, and that means that there are multiple disciplines under one roof that all work together to rehabilitate these injuries. And most importantly, research has come a long way, and there are a lot of clinics out there that haven't quite kept up with the rapid development of the science of how we treat this injury. And Aptiva is on the forefront, on the cutting edge, working hard to make sure we're administering treatments and assessments for this injury that are right on the cutting edge of the science.
Dr. Manderino, thank you for your expertise. All right, told you we had answers, courtesy of Aptiva Health and Dr. Lisa Manderino. All right, we'll take a break here, and then coming up, we'll talk about the Friday edition, the Feel Good Friday edition for Wave Country. Don G will come in and give you a preview.